Can this weight loss injection cause acne or skin breakouts? Acne is not listed as an adverse reaction in Tirzepatide's FDA prescribing information. The primary documented skin-related effects are injection site reactions like redness and swelling. Does Tirzepatide cause acne or skin breakouts? That's a question a lot of people have when they're starting this medication, and it makes sense to want a clear answer before you begin. Here's the short version. Acne is not listed as an adverse reaction in the FDA prescribing information for Tirzepatide, and clinical trials did not identify breakouts as a significant side effect. But there's more to the story, so let's walk through it. Tirzepatide, sold under the brand names Mounjaro and Zepbound, is a dual GIP and GLP-1 receptor agonist. It's FDA approved for managing type 2 diabetes and for chronic weight management in adults who meet certain criteria. It works by helping your body release insulin when blood sugar rises, reducing glucagon, slowing digestion, and lowering appetite. Now, when it comes to side effects, the most commonly documented ones in clinical trials were gastrointestinal, things like nausea, diarrhea, and vomiting. The skin-related effects that were actually documented are mostly localized to the injection site, redness, itching, or mild swelling where you give yourself the shot. Those are the primary dermatologic effects the research has identified. So where are the breakout reports coming from? They're largely anecdotal, people sharing their experiences online or with their doctors, rather than findings from controlled trials. And when researchers and clinicians look at why some patients might notice skin changes, a few indirect factors come up. First, weight loss itself can trigger hormonal shifts. As your body composition changes, hormone levels can fluctuate, and hormonal changes are a well-known driver of acne. Second, when people start Tirzepatide, they often change what they eat, sometimes significantly, and dietary changes can affect skin for some people. Third, starting a new medication and adjusting to physical changes can be stressful, and stress is another factor that research suggests may contribute to breakouts. None of these are direct effects of the medication itself, but they can happen alongside it. So what can you do if you're noticing skin changes while on Tirzepatide? First, bring it up with your doctor or a dermatologist. Don't assume it's just something you have to live with, and don't assume it's definitely the medication either. A healthcare professional can help figure out what's actually going on and whether it's related to the medication, lifestyle changes, or something else entirely. It's also worth reviewing your skincare routine. Sometimes changes in diet, hydration, or stress levels call for adjustments in how you're caring for your skin. A dermatologist can give you personalized guidance there. One important note, Tirzepatide is a prescription injectable medication taken on a schedule determined by your prescriber. Never change how you take it without your clinician's guidance. On the safety side, mild injection site reactions are common and usually resolve on their own. But if you notice anything more serious, like a widespread rash, hives, significant swelling, or any signs of a severe allergic reaction such as trouble breathing or facial swelling, seek emergency care and call 911 right away. The same goes for any skin changes that are persistent, spreading, or causing you concern. Don't wait it out. Reach out to your doctor. To recap, Tirzepatide is not documented to cause acne in clinical trials or FDA labeling. The main skin-related effects are at the injection site. Any breakouts people experience are more likely tied to indirect factors like hormonal shifts from weight loss, dietary changes, or stress. And if you're noticing skin changes, talking to a healthcare professional is always the right move. This video is for general information only. It's not a substitute for personalized medical advice. Your doctor knows your full health picture, and they're the right person to guide your treatment. If you found this helpful, drop a comment below, especially if you have questions about Tirzepatide or other topics you'd like us to cover. And if you want more evidence-based health content like this, make sure you like this video and subscribe to the channel.